Good morning, my name is Tressa. Today is the 27th of March and approximately 10:20 I will be performing the mixed insulin administration and an insulin pen administration. So before I go into the room, I'm going to verify my blood sugar level of the patient to verify how much insulin I will be giving. I'm also going to grab my supplies, making sure that my insulin pen is in the room and I have a tip in the room with alcohol swabs. I'm going to go in the room, I'm going to ask them their name and date of birth to verify that I have the correct patient. I'm going to ask where the last administration of the insulin was given so I know to rotate the sites. So today I will be administering into the abdomen. I'm going to position them in the correct position and making sure that they understand what I will be doing. So first thing I'm going to do is do hand hygiene. I'm going to put gloves on. So now I have gloves on, I'm going to look at my insulin pen, making sure that it is the correct ordered insulin. I am also going to take the cap off. I'm going to look at the expiration date and make sure that the insulin inside of this is clear. Now that I verified that, I'm going to roll the pin 10 to 15 times between my hands. I'm going to uncap it. I'm going to clean the top of the pin. I'm going to apply the needle. I am going to take off the caps. Giving 2 units, I'm going to prime it with. Okay, and then I'm just going to push the insulin out to verify that the pin works away from the patient. I'm going to recap my pin. Now I'm going to prep the client's skin. I'm just gonna wipe it down. I'm going to wait until the area is dry before administering. I'm now going to give 5 units of the insulin. Okay, I'm going to uncap my pen, squeeze the skin at a 90-degree angle. I'm going to insert the pin. I'm going to hold it down and keep it in their skin 5 to 10 seconds after administration to ensure that they received all the insulin. I will pull back out of the needle, recap the needle. I'm going to take the needle off, and that goes into the sharps container. And I will recap my insulin pen and put that away. I'm going to also document how much insulin they received and how they tolerated it, and what side I gave it into. So the next thing I'm going to do is the mixing of insulins. So I would do the same thing, was to verify their name and date of birth, make sure they have the correct blood sugar with the amount of insulin I am giving, make sure they understand the procedure and that they're in the correct position and that I'm doing in a site that is different from the last time of administration. So I'm first going to verify with my vials that I have NPH and regular insulin. I'm going to verify their expiration date to make sure that they're not old. I'm going to roll the cloudy or NPH into my hands 10 to 15 times. I'm now going to clean the top of the vials. Okay. So I need to make sure that I have the correct needle. So anything with an orange top is insulin needles. I'm going to pull back 8 units of air. I'm going to insert the 8 units of air into the cloudy. Take it out. I'm going to now pull back 4 units of air. And insert that into my clear. I'm gonna now pull back 4 units of clear. Making sure I have no air bubbles. I have 4 units of clear. Now I'm going to pull back the rest of my cloudy, which should equal 12 units total, but making sure I do not want to pull back more than that. I'm going to verify that I have 12 units in there prior to taking the needle out of the vial. I will then take the needle out of the vial, recap my needle, or my insulin needle. I'm going to now prep the patient's skin. I'm going to let the air dry. I am now going to take the cap off, pinch the skin, 90 degree. I'm going to insert the needle, administer the insulin, pull back. I will remove, or I will put the needle, used needle, into the sharps container. I will document the site that I administered, how they tolerated the procedure, and how much insulin I gave. And that is it.